Welcome to Humanizing Healthcare, where we talk with innovators and thought leaders who are working to make healthcare experiences more compassionate and rewarding for all. Our host is Chris Malone, founder of Fidelum Health and author of the award-winning book, The Human Brand: How We Relate to People, Products, and Companies.
Welcome to Humanizing Healthcare Live. We are here at the International Patient Experience Congress in Abu Dhabi, United Arab Emirates. I'm Chris Malone, and I'll be your host for today's discussion. I'm pleased to welcome Praveen Lobo, Chief Executive Officer of Synaptris. Welcome to the program, Praveen.
Thank you, Chris.
So Praveen, I see from your background that you started your career in technology and have stayed in the technology sector your whole career, but during that time you progressed through your career from working and living in India to now in New York City in the healthcare industry. How did all of that come about? What's the story of your career?
Thanks, Chris. It's an interesting story. I started my career in India in the hardware and networking business, and we launched all the big brands in India in the early 90s with Compaq and Cisco and all the big networking brands. And then I moved to the Middle East and ran a small business in Dubai building software for small businesses.
Okay.
And then I was recruited back by my original company to move to New York during the dot-com boom to build software for dot-coms. And you will not believe, but Amazon was one of our early customers when it was a bookshop. And we had a team in India that wrote crawlers for Amazon that would crawl bookshops and put it up on the Amazon site. But long story short, the dot-com boom was going bust as soon as I got there. And as expected, things didn't quite work out with that company. It was good at first, but then it went down with the rest of the dot-com bust. But luckily for me, I was introduced to a friend who had built a DICOM medical imaging viewer for Philips in India and wanted to get into the US market. And so I looked into that space, and I figured it's not too much of competition. There's GE, Siemens, Philips, and a few others. How hard can it be? Little did I not realize that the sales cycles were 18 to 24 months in healthcare, and there was a thing called the FDA that you needed to get approval from before you could sell any diagnostic device in the US. But long story short, again, I learned the technology. We ended up building a medical imaging system, the first web-based medical imaging system in cardiovascular imaging. In fact, we installed the first, in partnership with IBM, the first storage area network, which was the everything online drives for PACS systems.
Wow.
It was a 40 terabyte SAN storage area network those days, which was the biggest storage at Mount Sinai Hospital. They were our customers. And so we had a good run with that. And then I moved to another company in cardiovascular to build registries and data analytics, and also medical imaging, multimodality medical imaging, in a company called Lumatics, which I worked for in product management and built several products there. Moved their products to the cloud. That was another thing, the first thing we did. So we sold that company to private equity about 5 years ago. And I took over this company, which was a small company building workflow automation. And I was very interested in AI when AI just came out. And I was wondering how AI could be used in healthcare because of my so many years of background in healthcare. And one of the problems we had in my previous company was we were in the business of data collection and data extraction from unstructured sources, and it was primarily done by humans, which are data abstractors. There are hundreds of quality measures that need to be collected and submitted to national registries. It's all done by humans. Billions of dollars are spent. And when the first chatbots came out, I was intrigued and said, if this thing can read lots of unstructured text and answer very specific questions, I said, I wonder if we give it very specific clinical inclusion-exclusion criteria, would it be able to answer very specific questions and potentially replace the abstractor, human abstractor? And lo and behold, we tried it with a few clinical charts, and it was really good. at first not that good with 3 and 3.5, but once the OpenAI came up with 4.0, that model was just blew everything out of the water. And I told our guys, it's time for us to build a platform that can at least do this. And so that's how we ended up building Kezava Health platform that can now ingest unstructured data from the EMR and structured data from other sources and be able to make decisions or execute clinical decisions based on the input that we get from unstructured data. And so it tied AI into our existing workflow automation solutions to create interesting solutions in healthcare where we can now use AI and workflow automation to improve patient experience, staff experience, and ultimately improve outcomes.
Amazing, amazing journey. So tell us a little bit more about Synaptris. You've kind of led us through the story and how you're using AI with your workflow automation and so forth. Are there some examples you can share of organizations you've worked with? You mentioned Mount Sinai, for instance. Any examples of how they're using this and what some of the outcomes are?
Absolutely. So one of the use cases is, as I told you, using registry abstractors. Mm-hmm. So we have just signed a contract with the Boston Children's, which is part of Harvard Health System. Mm-hmm. They have about 35 abstractors that they use for a lot of their pediatric registries. So we will be testing out using AI to assist the abstractors in collecting the data. At this point, we feel like our accuracy rate is like in the high 90s, and we are able to get almost 100% of the data that is collected by an abstractor. But we are positioning right now as we can reduce the cost by 50%, but we really think cost will come down by 80%. So that's one product which we call Kezava Extract. Mm-hmm. And there are hundreds of registries in a hospital. We are also talking to another health system about extracting core measures data for CMS. Mm-hmm. Sepsis is becoming a big problem right now. Of course. So being able to look at real-time data, not only historical charts, but real-time feeds of blood pressure, fever, heart rate, and be able to predict who is a patient that may be trending towards sepsis is another thing that we are working on, so that you can take proactive actions like giving antibiotics in time or prescribing lactate tests and so on and so forth. We've also approached by a couple of hospitals whom we knew, which had a problem with incidental findings for cancer. As you know, 80% of all findings with cancer are found incidentally. And it turns out that all you need is to be able to read a CT or an X-ray or a DEXA scan or MRI and be able, or a report, like a radiologist report, and be able to determine from that, is the patient at risk or not at risk, and the degree of risk, and then be able to trigger a care pathway based on that risk. So we ended up building this platform with AI and workflow automation. So now with AI, you get a data point, for example, is this patient at risk for lung cancer? And then based on known protocols, our workflow automation engine ingests the rules to say, if it's high risk, then do this, 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 and this. So it handles the care coordination issue, which is a big problem in hospitals. It's a big hole filled by humans. And it's inhuman to ask somebody to track that many things for that many patients. So we have built this platform now where AI not only detects at-risk patients, but also keeps a track on the care tasks that need to be executed for each of these patients. So it's helping staff keep track of patients and reducing that cognitive load on the staff so that patients can be cared in time and no one's falling through the cracks. So that's another use case that we're working on. And we're talking to several other hospitals right now, and we're discovering more and more use cases for this whole AI-based detection and execution mm-hmm. of care pathways. We're talking to a hospital in Saudi Arabia right now, where they want to track diabetes patients and go through a whole care pathway with them. Another hospital wants to manage heart failure patients. Another hospital is looking to track CRTD and ICD patients. So the use cases are becoming endless right now, And I'm really excited about the future of this platform.
Wow, it sounds like there's a wide range of applications, everything from administrative and saving the manual registry, all the way up to the predictive diagnostics that help identify those patients at risk for a wide variety
Yes.
of potential incidents and outcomes.
Absolutely.
Now, I wonder, from your perspective, are there particular use cases around patient experience that you're looking at as well? A lot of what we talked about thus far is administrative and diagnostic. Anything on the patient experience side in particular that you're finding?
Yeah, of course. So you would think that scheduling an appointment is an easy thing, right? But turns out if I have to see my primary care physician, it's a 6-month wait. And this all falls under what we call as access. And if you look at the top 3 problems of the C-suite, access is always number 1. And something as simple as getting through to a phone line sometimes can be the bottleneck and the problem to getting an appointment. So we are testing out using AI, voice AI, to help people schedule appointments, patients schedule appointments, which is one is you call in and you have AI answer. AI then connects with the EMR automatically, looks for open slots, offers them the slots, and is able to book the appointment without any human interaction. But at any point, it's able to transfer the call. But then there are other use cases where you need to call out, like proactively. So for example, somebody we talked about earlier, identifying patients who are at risk for lung cancer. Now, the follow-up protocol, if it's lower risk, is you have LDCT every 1 year. If it's medium risk, it's probably 6 months. Now, somebody is going to forget to get that scan, and the patient's not going to remember that it's time for me to get my next scan. So we have AI now. Look for the order. As soon as the order is received, and there's a whole other process which we talked about earlier, making sure that the order is put in the first place through the care coordination tasks. But once the order is put in place, voice AI picks up that order and says, patient John Doe needs LDCT by December 30th. I'm going to start calling him 1 week in advance. And it automatically calls him out and says, hey, John Doe, it's time for your LDCT scan. We have received an order from Dr. Williams. Would you be able to come in sometime in December, the last week of December? And it has a nice fluid conversation, naturally speaking, and this takes the load off the humans, where you outsource normally this to call centers who don't really do a good job. And so AI can really consistently follow up, not only through calls, but through multi-channels, text messages, emails, and offer the same experience of being able to easily book an appointment so that that loop is closed, and that task of having your 6-monthly or 3-monthly or yearly LDCT completed, just to round off the example. So that's, I would say, one example of improving patient experience, at the same time assisting the big problem of access, which the C-suite is so worried about all the time.
Yeah, and I think that is a great example because, from a patient perspective, it's hard to understand why it's so much harder to make a medical appointment than it is a dinner reservation or a hotel reservation. But there's a lot of complexity going on in that background,
Yes.
Referral authorizations and insurance authorizations, and fit within the staffing of that particular location and date and all of those moving parts and so forth. So AI can help navigate that complex process that currently is being using humans to navigate. That would be a great improvement because for many patients, just the difficulty of getting in is half of what keeps them away.
Absolutely, and I can give you another example. In colonoscopy in the US, one of the stats is 20% of the patients who are scheduled for a colonoscopy do not adhere to their prep correctly. And so the patients coming to the procedure, colon is not clean, need to be sent back, or nodules can't be visualized. It's just not a good situation to be in, and 20% is a lot. And so we have found that, just nudging the patient along that journey for that last 1 week, did they buy the prep? Did they take it in time? And so we have these messages that go out, either voice calls or text-based messages, and education too. We have multimedia videos explaining to them not to get worried if something happens about, and it's a stressful time. Prep is not an easy thing to go through for some people. And so we guide them through that entire journey. And at any point, they can pick up the phone or through the bot, talk to a human being and be guided through the process. So that's another example where we are using AI and automation to nudge patients and improve their experience so that they find it easier to go through that journey. And for the hospital too, and for outcomes, ultimately, it benefits everybody. Everybody wins in the process.
Yeah. I think the last part that you mentioned there, you still have the opportunity to talk to a human, is really critical.
Yes.
Because how many of us have been kind of caught in that endless confusion loop,
Yes.
that there isn't an option that lets you talk to a human.
Yes.
And I think that as long as people have that option, they will be ready and able to embrace technology like these automations that you described.
Yeah, absolutely.
Now, Praveen, I'm sure during the course of your career, you've worked with many young and emerging leaders. There are many here at this conference, probably many who aspire to be a chief executive themselves. I'm wondering, during the course of your career, what wisdom or advice would you offer to someone aspiring to that kind of role? Any words of wisdom that you can share with them?
Yeah, I would say, I never expected to be a CEO. I just happened to, I didn't want to be a CEO, but I just got into this just by chance. But when I look back and I think, how did I get here? I think there were a few things. I never knew anything about any line before I started. I went to school not to study engineering and not to study software, but I got into the hardware and networking business. I didn't know a thing about a computer, but I was curious and I learned. I struggled a lot in the beginning. I didn't know the difference between a hard drive and a floppy drive in those days. But I sat with the engineers and learned and persevered. Same thing when I got into healthcare. I knew nothing about healthcare, but I went into the cath lab, put on my lead, went with the fellows. It was literally, I did a fellowship with them and learned everything about the cath lab and coronary interventions. And so I would say, if you are curious and be a constant learner, but also never be afraid of complexity, because you can learn anything. If somebody else could learn it, so can you. So I think, like, taking away those mental blocks and never believing that something is too complex for you to understand. And when I look back the things I've learned, like, I'm shocked sometimes, how did I learn it? I never went to school for this. But it's just curiosity to learn, and also do not be afraid of difficult things. And be persistent. Don't give up the first attempt, third attempt. It's just perseverance and grit will get you there sometime.
Well, I saw a number of things there. One is curiosity, lifelong learning, persistence, and never giving up.
Exactly.
Yeah.
Yeah.
So our final question, and one of my favorites, is, do you have a favorite quote you can share with us? And if so, why is it your favorite quote?
Yeah, I don't know where I read this, but it's probably some book my mother gave me when I was young. But it said something like, do more than you are paid for, and very soon you will be paid more than what you deserve. And I think that has been something back of my mind. Whenever I did something, I never did it for the money. Mm-hmm. I did it because I enjoyed it, and I wanted to do it well, and I wanted to serve whoever I was serving. Everything we do is to serve other humans. And I just realized over a time, like, I never asked for a raise in my life ever, but things just came to me, and even today when I'm the CEO, I never asked for this job, I got it. It's just because, you keep doing things, and I think that's one thing that's one advice I would have for people, like, do not think about the money, whether it's initially in your career or even later on in your career. The money will come. Do good things.
That's very good advice. I'm definitely going to be passing that along to my 3 sons.
Thank
because
you.
doing more than you're paid for, ultimately you'll get paid more than what you're doing.
Absolutely.
Yeah. Praveen, thank you so much for sharing your wisdom with us. It's a real pleasure to talk with you. Thank you to our listeners as well. Please be sure to join us again for another episode of Humanizing Healthcare Live, where we'll talk with another healthcare leader and innovator. Until then, be well, and thanks very much.
Thanks for listening today. If you enjoyed this episode of Humanizing Healthcare, please give it a rating, share it with others, and follow us at Fidelum Health on LinkedIn. And make sure you join us next time as we share more insights from another inspiring healthcare leader and innovator.